السلام عليكم.
عليكم السلام ورحمة الله.
عليكم السلام.
وعليكم السلام.
How are you guys?
Alhamdulillah. Thank you.
Alhamdulillah, fine.
Fine.
Alhamdulillah.
Okay, guys. Today, inshallah, we will start introduction for MRCEM OSCE course for the next batch for March, April. Some people they are ready for March and April, and some people they are for June exam, some people for July exam, some people for September exam, some people they are for November, and so we are supporting 2022. Okay, so we are supporting people till their exam. Here, once we finish this batch, so we can start the next batch. So if you have exam in June or July, you can get benefit from this batch. So if you want to, guys, can you hear me clearly?
Yes, doctor.
Yes,
Yes.
Yes,
doctor.
yes, doctor.
Yes,
Okay.
clear.
Okay,
Yes.
okay. And you can see the slide.
Yes, we can.
Yes.
Yes, we can see.
Okay, so here we make update every time. Alhamdulillah, we will make update. So I will post it in PDF for stations. After that, we can make discussion on them, practice on them. I know the people for March, you don't have too much time. Some people in previous courses or in previous exams, they have too much time. I remember people for last June, they studied for 1 year. Okay, so no worries, you still have time. And please, if you follow me and you do what I need, inshallah, you will pass with high score. Some people, they get the approach and they practice with themselves. It's not enough. Again, it's not enough to practice with your colleagues. Okay, you have to practice with me, because I will give you feedback if you are on the right track or not. Okay, if you are practicing with your colleagues, it will give you benefit for time management only. But how you know? Maybe you and your colleague not on the right track. Okay, practice with me. After that, I will give you feedback. You can slow here, you can accelerate here, you can use this word, don't use this word, and so on. After you feel you are okay, you can practice with your colleague. Okay, so don't practice without approach, don't practice without appropriate approach. Okay, otherwise you are wasting your time. Okay, so today we will talk about the course structure, and we will talk about the exam structure and the plan, what we will do in this short time. Okay, so here we have inshallah 200 stations, and the materials, if you will depend on the course videos, if you will depend on the course notes, no need to check any book or any videos. So if you want to check 125 you will find everything in our course. Okay, so don't waste your time in any other source. Okay, because we collected all sources in our course. Okay, so if you want to check examination, it's up to you in GKMedics, but here examination is the most important to understand what to do in the examination. Sometimes it's not mandatory to do some actions in the examination. So we will give you the tricks in the examination. It's not about the examination itself. Everything will be clear later, inshallah. So the course structure and the exam structure will be 6 parts: history taking stations, psychiatry and toxicology stations, communication skills stations, practical skills and teaching stations, systems and joint examination stations, ALS, ATLS, ABLS, and the newborn resuscitation stations. Okay, so what I will do in this short time, I will give you teaching from today till the 1st of March. I will give you teaching from today to the 1st of March. So teaching will be with practice as well. From the next session, it will be with practice. Anyone ready for practice, you can raise your hand and we can practice. I will mention the station in the group regarding I will mention the station in the group regarding the station we will discuss and we will practice. Okay, so anyway, regarding history taking stations, 50 stations, I will give you a PDF. Already we have PDF, but not concised. So I will make them concised. We have 2 channels, one channel not concised and one channel, it will be for concise approach. Okay, some people, they want both. Some people, they want both. I took feedback from most people. I said, this better or this better. Most of them, they said we need both. Okay, so I will keep the not concised one. What do you think, guys? I want your opinion also.
Yes, better to keep both, Dr. Hani.
Okay, who else?
Concise
Both,
one.
both.
Dr. Hani, keep both. Keep both.
Okay.
Yeah.
Concise.
Need precise, Dr. Hani.
Concise.
Concise, Dr. Hani.
Yes, we
Concise.
yeah, we will get both, and it's up to you if you want to join this channel. If you want to join this channel, it's up to you. So if you have both channels and if you want to study the concise, you can go to the concise channel. Okay. Okay. So in history taking, guys, you will get 50 PDF, and to pass this exam, the most important history taking, because at least 5 or 6 stations. Okay. Psychiatry and toxicology, I will give you a PDF for a concise approach as well. So part 1 and part 2, it will help you to pass the exam easily. Regarding communication skills, it's difficult for me at the moment to give you a PDF for all, but at least I will give you general approach PDF. Okay, I'm talking about communication. Regarding system and joint, I sent already a joint PDF because the most likely in the exam, injured patient, they said in the curriculum, injured patient. So injured patient here, it means joint examination, guys. Okay, so I sent already. Regarding resuscitation, they can ask you about ALS, ATLS, ABLS, and the newborn resuscitation stations. So it's mandatory. I will give you general approach for, I'm talking about PDF. I will give you, inshallah, general approach for LS, general approach PDF for ATLS, general approach for ABLS, and newborn, it's only one station, so I will give you a PDF for that. Okay, so again, you will get all PDF concise for history taking. You will get PDF for psychiatry toxicology. That's a general approach for all stations. Regarding here, communication skills and stations, I will give you a general approach. Okay. Here, joint examination already I sent. So regarding resuscitation, I will give you general approach for each one. Is that okay with you guys?
Yes, sir.
Yes, sir.
Okay. So please don't share this recording or don't share this PDF. As you know, we are making effort in this materials, and I'm working on them for more than 10 years. I'm collecting from all sources to give you a good material and good approach to pass with high school. So our aim, it's not about to pass. I'm aim to pass with high score. Okay, and alhamdulillah, we have a good score and with good rate, real good score and real good rate. Some people, they are posting fake rates. No, we are posting real rates, and already you can ask your colleagues and ask, and you can see yourself. Okay, alhamdulillah. So here we finished already batches for 2021 for March, June, July, October, November, and here we will start. We finished also January for 2022. We will start for March, and again we are supporting June, July, September, October, and November. So unfortunately, people for July, they did not get a slot. They just opened for 1 day, right, guys?
Sir, for 4th and 8th July in Chennai, India, Chennai.
Indian slots were closed within
India slots
1
are
day,
closed. Yeah.
and I mean the slots were too tight also. I mean the site was down for many hours. Somehow we got it, but it was very bad actually.
Yes. So once you find the date open, so register quickly. Okay, please. So the next one is 28th February, right?
Yes, yes.
Okay, so be ready for that. Once it will open, you can be ready. And also, once you start the application, you will get reference number. Even you will continue your application after 1 day or 2 days or 1 week, no problem, because already you have reference number. Did you get my point, guys? Okay.
Yes.
Yes. Okay. So here, regarding history taking, you have stations for Socrates. You will use Socrates approach. So any station in the exam with pain, like throat pain, headache, chest pain, abdominal pain, pelvic pain, testicular pain, back pain, knee pain, leg pain. So you have to use Socrates approach. We will discuss in details later. Any station without pain, so you can use Odibara approach, like throat discomfort, dizziness. So the same throat discomfort or throat pain, it's a different here. If you ask the patient, he said throat pain, you will use Socrates. If he said, I have throat discomfort, so it's Odibara. So according to the complaint, okay, dizziness, TIA or stroke, visual disturbance, palpitation, SOP, cough, jaundice, rash, urine retention. And here you have to check comfortability of the patient. Okay, so how can I help you? I have urine retention. I'm sorry to hear that. So you will take history or you will relieve the retention, guys, first.
Have to relieve that retention.
Of course. So you have to relieve the retention first. Okay. So any patient has chest pain, I will give you painkiller. And after you give him painkiller, are you comfortable now? Okay. So check comfortability first. A swollen knee joint, lower limb swelling, puffiness of face, myalgia, weight loss, or weight gain. So you have to use Otipara. And the I here, remember, I intensity means severity. We will use especially in bleeding. So special stations, we are talking about travel history. So it will be only in 2 stations. So you can use in it diarrhea or fever. Okay. Sexual history. So here, sexual history only in 2 stations, dysuria or urethral discharge, whatever male or female. So don't use as a routine in all stations. You can use only in these 2 stations. Amenorrhea. So amenorrhea here can be primary or secondary. So once you ask the patient, when was the first menstruation? If she said at 13 or 14 or 15 or whatever, so it means it's a secondary. If she said I don't have menstruation before, it means it's a primary. So one word, one question, it will be easy to get a primary or secondary. Okay. Bleeding stations. So you can expect whatever nose bleeding, post-tonsillectomy bleeding, upper or lower GI bleed, hematuria, vaginal bleed. It's very, very important because in every exam, they can give you one bleeding, okay? They can give you one pain, one Odibara. So one Socrates, one Odibara, one bleeding, one who approach. We will discuss now, okay? So here regarding bleeding stations, the most likely in MRCEM OSCE, upper GI bleed or lower GI bleed, hematuria, vaginal bleed. Nose bleeding and post-tonsillectomy bleeding, it's common in FRCEM OSCE final. Okay, so anyway, we will give approach for them as well. So I want to ask about bleeding questions, guys. We have 5 to 6 questions, 5 to 6 questions for bleeding. We are using Odibara. When we are using questions of bleeding in Odibara, Odippara. Which one, guys?
High intensity.
Intensity.
High.
Okay, so intensity, it means severity. If the patient has fresh bleeding, so it's severe. The patient has how often? Ask him about how often. He will say, for example, 6 to 7 times. So it's a severe intensity. Here you can ask about the color. Okay, is it with clots or not? Okay, for example, if vaginal bleeding, how many pads did you use? Okay, and so on. We will discuss everything in details, but remember that. Who approach? Who approach here if you have event in the exam? Okay, if they ask you, take history from the patient. So how can I help you? I have episode of fall. I'm sorry to hear that. And after that, use who approach. So any event in the exam, you can use who approach, and we will discuss about who approach later. Syncope, whatever the cause is, cardiac or CNS or pregnancy, you have to use who approach. Okay. Diabetes. How can I help you? The patient is not talking, unconscious. So you have to, you will take history from the patient unconscious, guys, or you will treat her first?
First treatment, sir.
First treatment. How you will take history from her? She's unconscious. Okay. How can I help you? She's not answering. So I want to check vital signs. I want to give the examiner will say blood sugar whatever 1.2, 2, 3. Anyway, it will be very low. So you will give IV. You have to mention IV because unconscious. Okay.
Yeah.
So here, after the patient is okay, introduce yourself. After that, are you comfortable? Are you okay? And explain to her what happened. After that, take history from here. You have one colleague present with her, so you can involve him, take consent from her to for him to stay with her. If she accepted, you can take history from him as well. But in the end, if you have time, and you will not get time, seizures. So seizures here, if you will use who approach, one question of who questions, you will ask how many episodes within last 6 months. She said this is the first time, so you will understand it's a first fit. If she said this is the second time or third time, you will understand it's a multiple fits. Pediatric, same as adult, but you will add 3 questions: prenatal, natal, postnatal, and developmental, and what else, guys?
Immunization.
Excellent, guys.
Growth and development.
Yes. So this is the difference between adult and pediatric. But if you find stations of Odibara, like the patient has dysuria, urethral discharge, whatever, sometimes dysuria only, sometimes urethral discharge only. So if you find any one of them, ask about the other. How can I help you? She came, sister with her brother 5 years, for example. Okay, you have to check why the mother is not here, why the father is not here. You have to ask yourself why the sister, for a reason. Okay, so you can ask, how can I help you? My brother has been on passing urine. I'm sorry to hear that. So check comfortability and you can proceed with that. Here, what are the differential diagnosis, guys? If dysuria or urethral discharge, what is the differential diagnosis?
It's a
PID.
pelvic inflammatory disease, non-accidental injuries.
UTI.
Okay, so we will talk about male first and then female. So if male,
Well,
STD.
Sexually transmitted disease.
sexual transmitted infection.
so it can be
UTI.
UTI or sexual abuse, right?
Yes, sir.
Okay, if female, for example, 5 years or 7 years,
And then UTI, sexual abuse.
what
pelvic
else?
Inflammatory disease.
It can be female genital mutilation also.
Yes.
Okay,
Yes.
if female, you can think about UTI, you can think about sexual abuse, you can think about female genital mutilation. But in OSCE, unlikely, okay, for female genital mutilation. Shortness of breath, wheezes, check the age. You have 1 minute preparation in the start. We will discuss now about how to get 10 out of 10 and the attitude and everything. We will talk about everything. But now we just starting with the plan, the course structure, the exam structure. Okay. After that, we will talk how to get 10 out of 10. Okay. So here in 1 minute preparation in front of the door. So check the age. More than 2 years, it will be asthma. Less than 2 years, think about bronchitis. You have only 2 differential diagnoses in pediatrics. Limping in child, you have 3 differential diagnoses. Of course, in practice, you have more differential diagnosis, but I'm talking for the purpose of the exam. So limping in child, you think about tenosynovitis, birth disease, so check the age. If you find in the scenario the age 1 to 3, tenosynovitis. If the age 4 to 10, what is the diagnosis, guys?
But disease.
More than 10?
Sorry.
Okay, so the age is very important in any station. Okay, the gender, male or female, because maybe pregnant. Okay, and so on. Rash. So rash here, if the patient maybe ITP, maybe Henschel-Lambert, maybe meningococcal meningitis. ITP, it's a common in MRCEM OSCE. Henschel-Lambert, it's a common in MRCEM OSCE. Vomiting, it's a common station. HBS. So check the age. If the age weeks, so hypertrophic pyloric stent.
Hypertrophic pyloric stenosis.
Yeah. If the age is month, so think about intussusception. And one of the criteria of Odibara, so associated symptoms, vomiting. So non-bilious or bilious, but in simple way, avoid jargon. Don't say bilious or non-bilious. Okay, you can ask about the color. Yeah. So we will talk about how to get 10 out of 10 later. So Odibara approach station. It can be a child abuse, whatever with non-accidental injury or not. So here, history from a father, it's a very common station. Very, very common station. The father divorced the wife or the mother, and she is living with her boyfriend, her partner. She is not married to the other one. She is just living with him. And the father just visited the child today. Don't be scripted. Don't be scripted. For example, your colleague, he has in the first day the station like that. They can change the same station. For example, the patient misbehaving. Okay, so if you ask the father, he can say just abnormal behavior. For example, not listening, not talking, not looking at you. Okay, not listening. Okay, so another colleague or another candidate, he can say seizures. Okay, so it doesn't mean the same station, but the same management. Okay, so maybe you will ask the father, did you find any tablet or any drugs in his pocket? Maybe he will say yes. In another candidate, he will deny. He will say no. Even your colleague in the same circuit. Okay. So for example, in the same circuit, you will find 18 candidates. One candidate, the actor will tell him, no, I did not find any tablet. The second candidate, he can say, yes, I found. Okay. So they are checking, and it's unfair for sure. It's unfair. For me, it's unfair. Should be the same formulation of the station for all people. Anyway, history from mother of a child who has dental abscess. How can I help you? My son has cheek swelling. So when did that start? 3 days, 4 days, 5 days. Did you seek any medical help? No. I did not seek GP consultation or any doctor. So it's a neglect. But if she said yes, his GP, he gave him painkiller, he gave him antibiotic, but not responding. So it's not neglect. Okay, don't be scripted. Don't fix your mind for specific station. Okay. Anyway, if you feel neglect, you have to involve pediatrician, social services, and also if you feel, for example, dental abscess, you have to involve a dentist. Okay, or you can say the doctor for teeth. Okay. Here, physical abuse. Physical abuse, for sure, it's a non-accidental injury. Okay, so sometimes it will be consistent with the mechanism of injury. How? For example, if the patient has fracture and limping, is it logic or not logic?
Logic.
Logic, sir.
Logic. You cannot say it's a non-accidental injury. But if the patient has fracture and she came because of sore throat, is it logic or not?
No.
Not logic.
not logic. But anyway, both of them non-accidental injury. Both of them non-accidental injury. And both of them, it will be obvious in the scenario. They will say the patient has suspicion of non-accidental injury. It will be clear. And if they did not mention that in the scenario, so you can understand also. They will give you X-ray. If they give you X-ray, so it's a non-accidental injury. Okay, we will discuss that in details later. Okay, who approach in children? So same event. If the patient has fits, for example, febrile convulsion, so it will be who approach. Ulti, the patient presented with unconsciousness or fallopi. Okay, so it means event. You will ask about who approach. Explain a new diagnosis. Explain a new diagnosis. It will be history taking, but here the opposite way. Here the opposite way. How? In all stations from 1 to 47, you will take history, and in the end, you will ask about ICE. ICE, it means idea, concern, expectation. After that, you will explain the management plan. But here, the opposite. In explain new diagnosis, the opposite way. So you will explain the disease, then the crisis, then ask about ICE, then the management plan. After that, you will take the history. Clear, guys? Okay, so here the patient will be presented with disease or with the crisis?
Crisis.
Crisis, most probably.
Crisis.
Okay, so the patient came because of the crisis, but the father doesn't know or the mother doesn't know. Okay, so you have only 3 stations for new diagnosis, guys, in the exam. Diabetes, and most likely it will be type
Type 2.
type 1.
Type 1.
Type 1.
Okay, the child 5 years, 4 years, 7 years, even 14 years, it's a child. Okay, so it's a type 1. So if you find scenario with ABG and the blood results, it means the patient in life-threatening condition and in crisis. And once you see the blood sugar, you will understand. If the blood sugar high, is it DKA or Addisonian crisis?
DK.
DKA. If blood sugar is low,
Addison.
yes, I want you to be very intelligent, guys, in the exam. Once you see blood sugar, don't waste time. Okay, just check other parameters quickly. Okay, so you will check other pH and because pH it will be low in both. So what is the benefit? Okay, the patient will be, for example, unconscious in both. What is the benefit? Okay, but you have to check the scenario because you will give information to the father. Just it. Okay, we will explain everything in detail. So number 1, you will introduce yourself to the patient or the relative, sorry, and after that explain to him about the disease. After that, explain to him about the crisis. After that, ask him, what do you think about that? What is your concern? What do you expect from us to do? He will talk, listen to him. After that, explain to him. Explain to him management. Management here, short term and long term. Short term, it means in ICU. He will stay, for example, 2 days, 3 days, 4 days, or whatever. After that, long term, how this patient will be treated for long life. Okay, whatever DKA or additional asthma as well. So explain to him about asthma and explain to him he presented today with critical condition, which is called life-threatening asthma. Okay, so after that, ask about ICE. After that, you can explain to him your management plan. It will be short and long-term condition. Psychiatry and toxicology, it's a general approach. You will use general approach for all stations. You have 4 points in psychiatry and toxicology. What are the 4 points, guys? Number 1.
Depression, cognition,
Okay.
Psychosis,
Capacity within the
self-harm.
Excellent.
Cognition, psychiatric illness, and self-harm.
Okay. So we have 4 points. You can mention them in all psychiatry and toxicology. Even you are not studying, you will get 10 out of 10. Okay. So number 1, depression questions. Number 2, cognition questions. Number 3, self-harm questions. Number 4, psychosis questions. Is it mandatory to arrange them? No need. Okay, no need. If you want to start by depression questions, okay. If you want to start by cognition questions, okay. If you want to start by psychosis questions, okay. If you want to start by self-harm questions, okay. But how to be organized? If you feel the station is depression, which point you will start, guys?
Depression.
Start by depression questions. If the station is mania, you will start by
Still depression question.
also depression questions. Okay.
Mm.
If the station is psychosis,
Psychosis.
question. Okay. So you will start by psychosis questions. If the station is cognition, all the confused. Confused, it means you will talk about cognition, right?
Yes.
So confused, you will talk about cognition, because cognition, it means orientation. Okay, the patient is alert, oriented. Okay, it means any patient old 80 years or something like that, you can start by questions of cognition. So again, you have 4 questions: cognition, depression, psychosis, self-harm. Remember that. If you remember that, you will get 10 out of 10 in all psychiatry and toxicology station. And here, the definition of depression, as you know, persistent sadness more than how long?
14 days.
2 weeks.
2 weeks.
Definition of depression: persistent sadness more than 2 weeks. How can I help you today? Maybe he will not talk. So continue. Don't repeat the same question. Okay. Maybe he will say, I feel bad. I'm sorry to hear that. We are here to help you. We are here to support you. Okay. And here you have to ask him, when did you start to feel that? He will say, for example, 3 weeks, 1 month. So it's more than 2 weeks. It's a depression. But if he said only today.
I'm sorry to interrupt. Should we do the regular things like introduce ourselves and take consent and ask for offer chaperone and other things like we do for taking history taking in this, or should we directly introduce ourselves and ask the questions related to depression, cognition, psychosis, and
all points you have to do. I'm now focusing on the most important points.
Thank you.
Yeah. So we will discuss everything in details. Now I am focusing on the most important points. We are in introduction today. We are not in teaching. Okay. So here regarding depression, more than 2 weeks, and postnatal depression, it will be same station but female patient. And they can mention in the scenario, the patient has birth maybe 1 week ago or 1 month ago. Okay, so you'll understand it's a postnatal depression. Mania, the opposite of depression. So the same questions for depression, same questions for mania, because in depression it will be yes, and mania no. So the same questions. Mania here, the opposite, it will be high mood. The patient is very happy. How can I help you? no need for help. I'm very happy. So the patient is with high mood. It will be more than 1 week. When did that happen? Or when did you start to feel happy? So I'm always happy. So this patient more than 1 week. Schizophrenia psychosis, it means hallucination and thought disorder. We will discuss everything in details. So psychosis here may be hallucination. Hallucination may be auditory by ear, may be visual by eyes, may be so see, hear, smell, or touch. You have 4 important points. Okay, so if you will say which is not there, one of the examiner to one candidate, he said to him, it's already there for the patient. It's real for the patient. So we can remove that from the approach. So you can ask the patient, can you see or smell or you feel something or someone touching you? So here, don't say which is not there. I will remove this sentence, okay? Because for the patient, it's there, okay? Which is not there for us as a physicians, but for the patient, it's there, okay? So anyway, thought disorder also. So do you feel someone is interrupting your thoughts or getting the idea from your mind? Okay, so the most important hallucination and thought. And here hallucination, it will be auditory or visual.
So auditory.
Auditory. Okay, so if you find the patient has psychosis, so start by questions of psychosis first. Ask about social history. So social history here, if the patient is using alcohol, so you verbalize to the examiner in the last minute, the patient has psychosis, symptoms of psychosis, and this is most likely because of drug induced. If she said, yes, I'm using illicit drugs, or you can say maybe because of alcohol. If she said, yes, I'm using alcohol. Okay, we will discuss that in details. So the task will be clear in the 1 minute preparation. They will say assess mental state exam. They will mention that in the end, assess mental state exam. So you will understand that. And they will say in the last minute, present your finding to the examiner. So in the last minute, you will go to the examiner, not go your face to the examiner and present your finding. You can ask the examiner, may I present my finding? Or he will stop you in the last minute if your time not managed. So he will stop you. He will tell you present your findings. So you can present to him. Another task, assess mental capacity. It means you will check, understand, retain, and what else, guys?
Retain, understand.
Understand, retain, weigh, and communicate the decision.
Communicate.
Yes.
Okay.
Yes.
Yes. Maybe assess self-harm. So the same approach. Anyway, whatever, assess mental state, assess mental capacity, assess self-harm, the same approach. Some modification, it's like 1% out of 10. We will mention that later, okay? Postnatal psychosis. So the same as psychosis, but the patient has bears. All the confused patient. So they will give you patient with 80 years and he is confused. So you will assess mental state exam. He will not say assess mini mental state exam. He will say assess cognition. So because he's confused, you will understand it's a mini mental state exam. In the last exam in October and November, he said assess cognition and the mental state exam. It means you will start by what?
Recognition.
Cognition. After that, the general approach. General approach, it means you will continue by depression, psychosis, and self-harm. Okay. Again, to understand psychiatric toxicology station, 4 points: cognition, depression, psychosis, self-harm. Done. Toxicology, they can give you paracetamol, they can give you iron, salicylate, TCA, and ask you about assess self-harm, or they can say assess the patient if he is safe to be discharged. Clear, guys? Same. Okay. So the most common in the exam, paracetamol or iron. Paracetamol or iron. So you have to be ready.
Sir.
Yeah.
Sir, I have a doubt, sir. In this station, substance abuse history, so we need to again take all history, like as you told, that all 4 type of history, like cognitions and that depression, and all history should be taken in this station.
Yes. Here I want you to use good skills in OSCE, guys. So when to use concise questions here, when to use complete questions here. Okay, so in station of depression, which one is important, guys? Questions of depression or questions of psychosis?
Questions of depression.
Depression, sir. Question of depression.
So you will focus on which questions?
Depression.
Clear?
Yes, sir.
The station is psychosis. They will mention, for example, in the scenario, the patient hear voices to kill her or to kill someone. So which questions you will focus on?
Psychosis.
Psychosis.
Clear? Clear now?
Yes. Yes, sir.
I want you to use that in all exams, not only in OSCE. I want you to use that in all exams. Okay. So here, toxicology, you will focus on psychiatric questions or you will focus on toxicology questions?
Toxicology.
Okay. So if the patient has paracetamol or iron, so you will focus on questions of drug self-harm. So the station is self-harm. You will focus on questions of self-harm. And regarding depression, 1 or 2 questions enough. Psychosis, 1 or 2 questions enough. Clear, guys?
Okay.
Regarding substance abuse history, for example, assess legal high. So here they can ask you to assess the patient and brief intervention. What does it mean? They will put task to assess the patient and brief intervention. Brief intervention, it means you will convince the patient to stop or decrease the amount. Clear, guys? The meaning of brief intervention? Okay. So assess here, it means you will ask the patient questions regarding the substance. Clear, guys? So assess, it means screening. For example, if you want to assess the patient for alcohol, it means you will screen the patient for alcohol. It means you want to know this patient is drinking only today, is drinking for years, is drinking a few amount, is drinking large amount. Okay, guys? So from your questions, already you assessed him and you will understand is he is dependent or not? Is it binge alcohol or not? Binge alcohol, it means it's only one time and he drank too much. Okay, so dependent, it means for years. Binge alcohol may be only today. Okay, anyway, so after your assessment, you will do brief intervention. It means you will convince him to stop or decrease. So what do you like in drinking? What you don't like in drinking? And also, did you try to stop? So this question you will ask him already. And in the end, do you think this will cause harm to you or harm your family? So in the end, you will ask him Do you want me to help you to stop or at least to decrease the amount? If he said so, you would refer him to alcohol or a drug specialist. So anyway, we will discuss everything in details. Also, cannabis hyperemesis syndrome. So the patient has long-term use of marijuana. Maybe he's using that for 1 year or 2 years or 3 years, and he has vomiting, continuous vomiting daily, and he's attending ER and no benefit. All lab results are normal. Okay, communication skills, we will discuss about breaking bad news. So maybe the patient already died, maybe going to die, maybe it's a serious diagnosis. Unlikely to be serious diagnosis in the exam, but think about died or going to die. Okay, we will discuss everything in details. Okay. Difficult referral. So maybe you will call the registrar, or maybe he will be in the ER by chance, like the last exam. They said the registrar by chance on ER, so you can talk to him for referral. And he will be difficult. He will be difficult, it means he will not accept. Okay, so anyway, it's stations common, DKA and pneumonia. The patient is hypotensive, so refer to ICU registrar. VB shunt, headache, fever, CT. So here they will give you scenario for patient with severity, because they will convince him to accept the patient. They will give you logic reasons. It's not about knowledge. They will give you the knowledge. They are not testing your knowledge. All the knowledge will be available in the report, okay? But they are testing you the steps. We will give you the approach for ISPAR. So if you will follow ISPAR, you will pass the station with 10 out of 10. So here, the patient has severe DKA, it's indication for ICU, has severe pneumonia, indication for ICU. So you will follow the general steps. VB shunt, the patient has CT normal, but it doesn't mean discharge. So don't accept, you have to refer. Chest pain, the patient has high risk for heart score or TIM score, so he needs invasive strategy, so needs cardiologist consultation. A Smith fracture, this patient don't accept to refer to fracture clinic, because here Smith fracture, it can be compromised and it can cause union and. So anyway, they will give you the X-ray and they will write in the report it's a Smith fracture. They are not testing your knowledge. Okay, guys, this exam, they are not testing your knowledge. They are testing your skills. Conflict resolution, maybe angry patient or relative, they will give you patient, they want the management or they refuse management against your opinion. So for example, here the mother requests antibiotic, okay, but you see it's a viral infection, no need for antibiotic. You have to convince here no need for antibiotic because it's a viral. We will give you the approach. And another station, the opposite way. So this time you want to give tetanus, but the mother is worried. She refused immunization because she is afraid of the risk. Okay, so which one needs a consent, guys? Number 1 or number 2?
Number 2.
Excellent. Number 2. Number 1, you don't want to give, so no need for consent. You don't want, you are the physician, you don't want to give antibiotic, no need for consent. But number 2, you want to give treatment, management, so needs consent, right? So consent, what does it mean, consent, guys? You have to explain indication, right? Contraindication, complication, risks, and benefits. After that, check understanding, retain, weigh, and communicate the decision. Clear, guys? Okay. Number 3, refused the charge. So she refused the charge. Why? You can ask her. For example, she refused the charge with you or your colleague, guys?
My colleague, of course.
Your colleague. You are the senior. You are the most senior. And your colleague, he is junior. He asked the mother, your child, he has vomiting, and this vomiting, it's just gastroenteritis, and he can go, for example, home. Okay. So she doesn't want. She came to you for second opinion, right? She said to the junior doctor, I want the most senior doctor here. And he referred her to you. She came to you not to complain, right? She came to complain or second opinion?
Second opinion.
Second opinion, okay. So she refused the charge. So how can I help you? I have blah, blah, blah. I'm sorry to hear that. I am the most senior here. I will say we are. I don't like I. We are here to support you. We are here to help you. Can you tell me more about that? My child, blah, 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 blah. So you can tell her, why do you think it's why you don't want to discharge your son? Because I am worried. Why you are worried? Because maybe he has appendicitis. Why do you think it's appendicitis? So explore. Okay. After that, ask about questions of appendicitis. I want to ask you about questions. These questions to see if it's appendicitis or not. Okay. So we will give you everything in details. Number 4, refuse discharge and request X-ray. So your colleague, he examined the patient, limbing a child, and he did not request X-ray. She came to you, and the same approach, she is requesting X-ray, and her concern may be limbing a child, maybe Bursa's disease. Okay, so you will ask her why you don't want to discharge your son. Because I am worried. Why you are worried? Because maybe it's a birth disease. So why you think it's a birth disease? My child, she will give you bad experience for her nephew or her son, another child. He has some problem before and is diagnosed by a birth disease. So you will ask her questions for birth disease. Okay. Conflict professionalism. Same. Your colleague has one patient for leg pain or whatever, back pain, another station, and she doesn't want to go home. He said to her, for example, you have leg pain and this musculoskeletal or back pain, musculoskeletal, and you can take only ibuprofen and go home. So here you have to follow the general approach and why you are worried. For example, leg pain, because maybe she will think it's a thrombosis, maybe ischemia. Back pain, she will think maybe it's a mass or compression. Okay, so here I want to ask you some questions, or I want to take some data from you to see it's serious or not. So you will ask questions regarding the leg pain. If the station is back pain, you will ask questions regarding back pain. Complaint. Here, the patient is coming to you. You are the most senior, complaining regarding your colleague. Okay. For example, patient pneumothorax, whatever, maybe pneumothorax primary or secondary. So here, it's not about small. Don't defend your colleague. Don't say it's a small rim of air and it can be missed by any doctor. No. Even it's small, don't say like that. Okay? So don't be defending at all. That's why in previous exams, they give them large secondary spontaneous pneumothorax because most people, they are defending. Okay, so anyway, even if it's small, how to deal with that? I'm sorry to hear that. We are here to help you. We are here to support you. I'm the most senior doctor here, and let me think about your safety first. So medical aspect first, guys. After that, legal aspect. Legal aspect means the complaint itself. Means your colleague. Means you will inform the consultant. It means you will inform everything. Okay, guys. I 1 second. I will send the link in the general group of the course because some people I did not add them. They are texting me private. I will send in the course group. Okay. So regarding here, how to deal with a small rim of air. Okay, let me examine you first. Are you comfortable now? Do you have any pain? If she said yes, let me move you to resuscitation room and check you are okay. Okay, and you will find X-ray. So check the X-ray, show the X-ray to the patient. Yeah, I'm sorry. Don't say it's a small rim of air. No. Yeah, you are right. Yeah, but you know, I have got news for you. It's a very small rim of air. Clear, guys? So you mentioned to the patient and the examiner that it's small, but you are not defending. I have got news for you. It's a very small rim of air. And at the moment, it doesn't need any intervention. So you have to ask about the age in the start. You have to ask about smoking. Do you smoke? If he said no. Do you have any lung disease? No. So you ask about 3 points, the differentiation between primary and the secondary. After that, I have got news for you. No need for intervention now. Okay, so he will be angry. No need to talk about my safety. What will you do with your colleague? So you can talk about that. So we are taking this incident seriously, and the consultant will be aware of that, and also we will discuss this incident with our colleague. We will make a departmental meeting. We ensure that this incident will not happen again, and so on. So we will discuss everything in details. Morning after pill, so the mother coming to you because you prescribed, not you, your colleague prescribed morning after pill for her, and also she's angry because she is child and they did not inform her. So anyway, you will discuss with her about Gaelic competence and the Fraser criteria. Gaelic competence first, guys, or Fraser criteria first?
Gaelic competence.
Gaelic competence first. Excellent. Okay, so which is first? You will talk about indications for MAP or Gaelic or Fraser? Indication. Okay, so you have to explain to her. She came with blah 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 blah, and these are indication to give her morning after pill. Okay, so you have to give her the reason why she took morning after pill first. Okay, we'll discuss everything in details. DNA CPR. So the patient has her mother, she arrested, for example, 2 times or 3 times yesterday, and the consultant take decision for not to do CPR. She has confusion. She think she will not receive any medicine at all, whatever oxygen or fluid or painkiller or. Just explain to her what is the meaning by CPR, what is the meaning by DNA CPR, and what is her concern from the start. Any complaint or any confusion, conflict, so start by ICE. Okay, what is your idea? What is your concern? What do you expect from us to do for you? Okay, so here we will discuss these things in details later. Counseling and advice. So BIPS, post-exposure prophylaxis after sexual intercourse, and post-exposure prophylaxis after needle stick injury, after blood splash. So you will take history here, but without Odebara, without the approach. So just go directly and complete the history taking, because she came just for counseling. Maybe they don't have symptoms. That's why don't waste time in Odebara. Pregnant mother and a child with chickenpox. So she came for counseling. She has child or nephew or relative with chickenpox, and she's worried. So she will ask you like 4 or 5 questions, and you will answer them. It's a very straightforward station and the knowledge, just the knowledge. It will. I will give you PDF for that. Miscellaneous. So consent from source patient after needle stick injury. Here is the patient, the donor. It means the nurse came to you, she has needle stick injury, but the examiner asked you to not talk to the nurse, no, talk to the source patient, the donor. So the donor here, will you say, can I help you, guys?
No.
No, of course no, because here in all stations in the exam, you can say, how can I help you? But this station, the only station, you are the one going to the patient, not the patient coming to you. You are going to his room, okay, in the ward. So you can explain to him, I am blah, 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 and I am here because of blah, blah, blah. Are you blah, blah, blah? Yes. Explain to him why you came to him, okay? Because he doesn't know you, he doesn't know why you are coming to him and what is the issue. Clinical decision unit, so it's a handover. It's only 2 stations, sorry, 2 cases, 2 cases. You will endorse or you will hand over 2 cases from him, and he's a junior doctor, and he will give you management plan, maybe a wrong management plan or incomplete management plan. Management plan, I'm talking about symptoms, signs, vital signs, and also workup, investigations, and the management. So 5 points you have to ask about them and to correct them. After that, you go to the next case. So start by the most priority. Difficult conversation with a colleague. So the nurse complained to you about behavior of one of the colleagues. Maybe he is not using hand hygiene. How you will talk to your colleague? You are the most senior, and he is FY1 or FY2, and you are talking to him about he is not using hand hygiene, or he is not using PPE, or he is not doing any procedure properly. So, or maybe he is using alcohol. He smelled alcohol. So you have to be familiar when to inform the consultant, when to inform the clinical supervisor, when to inform the medical director, when to inform GMC. We will give you all details later. Here, certified nurse midwife, CNM, certified nurse midwife, relative to family of non-accidental injury. They will give you patient suspected non-accidental injury, not confirmed, suspected non-accidental injury, and you have to inform social services and the pediatrician, but the nurse is not in your department. the nurse in the hospital, but in another department in OB-GYN. And she came to you because she knows the family and she is ashamed of them. So you have to teach her why it's a non-accidental injury and ask her about concern. Maybe she will say, I'm ashamed of them, and. We will give you all information about that. Major incident plan, triage save, it's not common, but it can be a station in the exam. So you have to be ready for any possibility. Even it's very rare, you have to study. Okay, practical skills. We will start by basic airway and all these stations. Also, these stations. Nerve block, very, very important in the exam. Okay, arterial cannulation and also intraosseous. But nerve block, very, very important. Sedation, very, very important. Nerve block, important. Wound assessment, very important. So they can give you suture or V-shape. Okay. System and joint. Which is the most important, guys? System or joint?
Joints.
Joint. But you have to study all. Okay. So they said injured patient in the curriculum. Injured patient, the new curriculum. So injured patient, it will be system or joint?
Joints.
Joint. Okay. The most important in system, cranial nerve, and also thyroid. And I'm talking about the most, then the least. So cranial, thyroid, after that peripheral vascular examination, upper or lower neurology examination, after that ear or eye examination, after that maxillofacial examination. Here in joint, the most common, hand, number 1, hand. Number 2, shoulder. Number 3, knee. Number 4, hip. Number 5, neck or back examination. What about ankle or elbow? They are not appearing. Clear, guys?
Yes.
Okay. I sent already the PDF for joint examination. Did you see, guys?
Yes, doctor. I've seen.
Okay. But please don't share. Please.
Yes, sure.
Okay. Resuscitation, it will be general approach for ALS, ABLS, ATLS, and the only approach with some modification, newborn resuscitation, but we will discuss all inshallah. So we will discuss this station. Okay. So the exam will be in the end of the course. We will give you mock exam simulation of the exam. It will be 18 stations. In the last exam, the Royal College changed the number of stations. Do you know how many stations in the last exam, guys?
14 it was.
It was 14, yes. So be ready for any change. Maybe at any time, they will say it's online. Maybe at any time, they will say it's a hybrid exam. Some station online, some station face-to-face. Maybe at any time, they can increase or decrease. They are moody, okay? So history taking, you can expect 5 to 6 stations. Psychiatry, toxicology, 1 or 2 stations. LS, ABLS, ATLS, 3 stations. And it's a mandatory now, the new rule, it's a mandatory now to pass 1 resuscitation station. Okay. Regarding examination, 2 stations, teaching 2 stations, procedure 2 stations, communication 2 stations. In the last exam, they said it's not mandatory to pass resuscitation station. Why? Because they decreased the number to 14. That's why they said that. But this time Now it's a mandatory if 18. Okay. Anyway, be ready for any modification. The exam for November, they give them 4 stations for examination. It was the first time for 4 examination stations. Okay, so be ready for anything. In the end, we will give you the expected stations. I am always giving the expected stations for all people, and alhamdulillah, they are getting the expected stations. Okay, so don't worry, you will find the expected stations exam, but the most important, study all, practice all, and be ready for any possibility. So how to get 10 out of 10? They will give you a scenario paper on the door, 1 minute, it will be on the door, and they will give you 7 minutes inside the station, inside the room. So how to utilize that? How to get 10 out of 10? Number 1, I have to emphasize on avoid jargon. Don't use medical terms until the actor is junior nurse or physician. So you can use medical term, no. Give information in chunks so it can be absorbed. So if you are discussing any information with patient, with nurse, with physician, so give information. After that, check if he understand or not. After that, give another information. After that, check understand. So, for example, I'm talking to a patient or nurse. I will give information. Is that clear? Blah, blah, blah. Is that clear? Blah, 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 blah. Did you understand? And so on. Okay. So piece by piece. For example, you are discussing with patient about DKA. I want to inform about your son after blood results, after blood gases, he was diagnosed with diabetes mellitus. Do you have idea about that? So check understanding. Okay. No. Would you like me to explain? And so on. So piece by piece and check understanding. Okay. So here some people, they have the general approach, but they are not getting I will not say they are not getting 10 out of 10. They are not getting even 2 marks. Okay, 2 marks. Why? They mention everything. They finished the time in 5 minutes or 6 minutes. Okay, and they did not get even 2 marks. Okay, why? Because the attitude. Okay, so number 1, to pass the exam with high score. Number 1, general approach, and this is our duty in the course. We will give you the general approach. Okay. Number 2, you use time management. Number 3, attitude, your body language, your sitting. Don't cross your hands. Don't cross your legs. Don't tilt your neck. Okay. Always your eyes in the eyes of the patient. Okay. Your eyes on the eyes of the patient. Good eye contact. Your attitude. You have to be comfortable and your patient comfortable. You have to be in the same level of the patient. Okay. Your tone, your speech, your rate, when to fast, when to accelerate, when to slow. Okay. When to low your speech, when to high your speech. Okay. So if the patient is breaking bad news, so your speech should be low, but you have to be clear with the patient and the examiner. He should hear you clearly. okay, and so on. Always the examiner will check that, will check your attitude, will check your eyes, okay? So how to get 10 out of 10? Communication. If you see communication in the pie chart, it doesn't mean it's your communication skills. You will find the communication in all stations. Communication, it means how to communicate with the patient, how to talk, sending and receiving, okay? How to give him simple language, how to listen to him, how to give him options, how to share a decision between you and him, okay? If you have nurse, how to communicate with her, how to give her a chance to ask you, how to check her understanding, and so on. This communication, okay? If you are in resuscitation, you are talking to your team, he's asking you about something, don't ignore him. But in the meanwhile, don't waste your time and take time in explaining to him, and so on. So, number one, introduce and inform what is the task is. Okay, so here, history taking, go to the patient, explain to him why you are here. Okay, I have been informed that you have chest pain. Is that right? Yeah. Okay, I'm sorry to hear that. And after painkiller, so I need to take some data from you. So you are here for what? To take some data. Otherwise, don't continue. Okay, I am here to examine you. Okay, I am here to take consent for blood sample and so on. Okay, so explain to the patient why you are here. Explain to him the task. So any task in the scenario, explain to the patient. After that, open and close the questions. So open question, you have two open questions. One is, how can I help you? How can I help you? Open question. And the second question, can you tell me more about that? So the first one, how can I help you? He will talk. After that, can you tell me more about that? And so on. After that, close the questions. Close the question, for example, do you have chest pain? This is close the question, yes or no. Okay. So in the start open question, it will give you marks because you are giving a chance to the actor to talk. But if you ask him, do you have chest pain? You are not giving him a chance to talk. He will say yes or no. Okay. So some people, they are asking, I will ask two questions together or one question by one question. If you will ask in the same system, no worries. If you will ask in the same system, no worries. For example, system of cardiovascular. So you can say, do you have chest pain or dizziness? Okay, no worries. But you don't ask about, do you have chest pain or urine problem? That's not connected together. Okay. Do you have chest pain or do you have a previous episode? No, it's two confusing questions. Okay. For example, if you will say, do you have chest pain or shortness of breath? No worries. Okay. He will say, if he has one of them, he will say, I have chest pain. Okay. Anyway, we will discuss about that in details. Invite questions from patient. So you have to be good listener also. If the patient is interrupting you, stop. Why he is interrupting you? They are checking your listening. Okay. So how can I help you? The patient will waste one time. No problem. No problem. Don't be disappointed. Don't show expression of disappointing because the examiner is checking your eyes. You will be disappointed or not. He will give you marks for that. Okay. So if the patient or the actor is doing anything because of instruction from the examiner. Okay. So invite questions from patient and the answer will in plain English. So simple way. Okay. Don't give him even not medical term, but sometimes it will be very difficult. Okay. For example, According to your data, I have possibility, I'm sorry to tell you, maybe it's a blood clot in the vessels of the lung, which is called pulmonary embolism. So this you are giving him example in simple way, okay? So we need to do scanning for your chest or imaging for your chest, okay? Which is called CTPA. So give him the explanation first, after that, the medical term for the examiner, and so on. Keep patient involved. So don't say, I will do blah, 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 blah. So give him a chance, okay? Is that clear for you? Yeah. Is that okay with you? So clear, checking, understanding. It doesn't mean he accepts. Is that clear for you? Yeah. Is that okay with you? Yeah. So the first one, checking, understanding. The second one, consent. Okay. So always involve him. Always share decision between you and him. Excellent rapport. So rapport here, it will give you marks. So may I know your name and age? Blah, 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 blah. Nice to meet you. Smile to him. Okay. This rapport. Okay. Empathic. So how can I help you? Blah, 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 blah. I'm sorry to hear that. So empathy here, marks. Good eye contact, marks. Appropriate body language, marks. Ensure patient comfort, marks. Okay. So are you comfortable now? Yes. Do you have any pain? No. So comfortability, it doesn't mean pain. Or pain doesn't mean comfortability. Comfortability means the patient has no symptoms. Pain, one of the symptoms. So symptoms here, pain, shortness of breath, chest pain, dysuria, any complaint, it's symptoms. Okay. So are you comfortable now? If no, don't start. Don't start taking data. Don't start examination. Don't start procedure until the patient is comfortable. Okay. So after you relieve him, check again, comfortable or not. For example, urine retention. How can I help you? I cannot pass urine. I feel I have retention. I'm sorry to hear that. Let me to make you comfortable first. Would you like, I will insert a small catheter to relieve the retention? Yes. Okay. After I insert, of course you will not do, just verbalize. After I inserted catheter for you, are you comfortable now? Yeah, thank you. Okay, guys, clear? Clear, guys?
Yes.
Clear.
Clear.
Okay.
Yes, yes.
Okay. So after that, logical sequence, logical here. So, for example, in a station of conflict resolution pneumothorax, you will start by medical aspect or legal aspect, guys?
Medical aspect.
Medical aspect. So in station, you start by logic approach, steps, okay? So logic approach, we will give you the logic approach, okay? Don't worry about that. Logic approach, it's our duty, not your duty, but your duty to follow us, okay? Confident, you have to be confident. So, but don't be overconfident, okay? So for example, I'm the most senior here. We are here to support you. We are here to help you. So you are comfort also. If the patient is comfort and you are comfort, the examiner will be comfort. Okay, guys? Okay. So appears calm and professional. Professional here, it means show the examiner that logic way. You are the most senior, you are help here, you are here to support here, and you give here logic approach. Okay. Complete task within time. So it means, for example, in resuscitation, I will lose marks if I will not reach ROSC. Yes. I will lose marks if I did not hand over. Yes. I will lose marks if I did not do debriefing My team? Yes. So I want you to reach ROSC. I want you to reach handover. I want you to reach reassessment. I want you to reach debriefing your team. Okay. So first of all, briefing and assessment, then reassessment and handover, then debriefing. So if you finish all and not finish all incompletely, no, finish completely. Okay. So in history taking, finish completely. Complete here, it doesn't mean details. No. Complete, it means all the checklist. Okay. So you can do the checklist by concise way, no problem. For example, you mentioned past medical history. Past medical history, it's an important point. If you will say to the patient, any past medical disease, done. So it's a complete and concise. If you mention past medical history, but not concise, it will be, do you have past medical disease like heart disease, lung disease, and 1 minute? So the same mark. Okay. So why you will waste time in all details? If he has something, he will tell you. Any past medical disease? Yes. Like what? If he said yes, explore. But if he did not say, jump to the next question. Okay. So complete your task within the time. It means you will mention all the checklist within the time. This is how to get 10 out of 10. Okay. Non-judgmental. So if you have suspicion, for example, non-accidental injury, don't tell her this one is non-accidental injury and you did not inform me about that from the start and. Okay. So don't be judgmental. Actively accept patients' cultural or behavioral differences. So you have to deal with the physician by different way if you deal with the nurse, by different way if you deal with patient, educated patient, different way if you will deal with non-educated patient. You have to respect him and change the way of language. So if you will go for non-educated patient, you will respect him and deal with him, communicate with him by very, very, very simple way. Okay. If physician, you can use complicated medical term, no worries. Okay. Do you agree with me, guys?
Yes.
Yes, Dr. Hani.
Okay. Involves team, helper, maintains cohesive working environment. So here, if you are in resuscitation, don't say give adrenaline, insert to IV access, and I finished my station. You will lose marks. Okay, so you have to involve your team. Okay? In preparation, involve your team. Introduce yourself to them. Okay? Involve your team. So it means, for example, if you have roast, excellent guys, we have roast. I want to blah 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 blah. So in any time you have to involve your team, and also helper. If you have a station of suturing, they said you have one patient inside, you have mannequin for the wound, and you have nurse and you have equipment. So don't talk with the patient and ignore the nurse. You have to introduce yourself to the nurse and also ask her to prepare everything and explain to her. For example, please prepare intralipid in case he has toxicity. So you are involving her. Okay. Interact well with the examiner. So for example, I remember I have one station, I'm talking about myself, and Alhamdulillah, I got the high score for this station. I talked with the patient, he was Indian, and I asked him, it was shoulder examination. I asked him, do you have any trauma? He said no, but I did not hear him. The problem from my side, not from the actor side, okay? I said no. And then in the end, after I finished the examination, I asked the examiner, may I present my finding? And I talked to him. I said, different management plan. But I said, because no trauma. And then the examiner asked me, who told you there is no trauma? I said, he said like that. And the actor, he said, there is trauma. And then I changed my management plan quickly, and I got high marks in this station. So I said, if there is trauma, so I need to do X-ray and blah, 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 blah. So anyway, if you are interacting well with the examiner, so he will consider your marks. Also, I have another station for sexual history. The actor said female 6 partners. I heard 6 partners. I thought the number are 6. Okay, so it will be high score, high risk. Okay, but for him, it's only 1 partner, so it's a low risk. The examiner understood that, and he took, not talk, he make non-verbal action. He was behind me, and the actor understood, and he said to me in the end, no, it's only 1 female sex partner. After that, I changed the management plan to the examiner. I said, I heard 6 partners. I thought it's a high risk. Now it's a low risk. So you can interact quickly and well with the examiner, and he can give you a good mark. Anyway, building a relationship. So using appropriate, this especially in history taking, use appropriate non-verbal behavior. So if the patient is talking, you can use your head up and down. It means you are listening. Or you can say, yeah, and so on. So non-verbal behavior, it means you are active listening. Developing rapport, as we said, emphasize. Involving the patient, explaining rationale, demonstrating appropriate confidence. Again, I will emphasize on avoid jargon, give information in chunks, check understand. Okay, so we are about to finish. So here regarding how to use 1 minute preparation, guys. So this station, you have 1 minute preparation. So what will you do? Number 1, check what, guys?
Pie chart.
Pie chart. So number 1, check the pie chart. Knowledge, clinical reasoning, team leadership, resuscitation. So you will understand it's a resuscitation, done. You will understand everything from number 1. Number 2, the task. The task always assess and manage the patient appropriately. The task always in the end of the scenario. So go from down to up, always like that in any exam, from down to up. So number 1, number 2. Now we will understand it's a resuscitation. Number 3, check the station. The gender, male or female, it's very important because maybe pregnant. The age, because is it ALS or ALS? Okay. Any trauma or not? Okay. Also, the station, drowning. Okay. So I understand now he is talking about drowning. 1 nurse. So you have to ask about another nurse because if you are safe doctor, you will work on a team. So if you will call the team early, you are safe doctor. If you call for another nurse for circulation management, you are safe doctor. Okay. So anyway, we will discuss about all stations in details later. But my point now, number 1, number 2, number 3. So in resuscitation, how to save time? Don't wait for response from the examiner. Okay. For example, in airway, I'm not teaching resuscitation, guys. I'm teaching you how to save time in all stations. Okay, how to get 10 out of 10 with concise approach, with concise way to save time. Okay, so here instead of you will say, I will open the mouse, any bleeding, any, you can ask the examiner quickly, what about the airway? Baton? If he said yes, done, finished the airway. I will not waste the time in airway. Okay. After that, I will go to breathing and so on. Okay. If he said no, it's not compromise. At that time, you can check any blah 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 in the mouse. And here it depends. 1 second, guys. Okay, guys. So here you have to ask about the most important and the most relevant information. So if the patient is anaphylaxis, you will ask about anything related to anaphylaxis in the mouse. Why I will ask about bleeding? The patient has anaphylaxis. Why I will ask about bleeding in the mouth? Okay. So you can ask any swelling in the tongue, lips, any hoarseness or stridor, done. The things relevant to the station, and so on. And if the patient has on the monitor any rhythm, so you can comment quickly. Don't look to the monitor for 1 hour. The station is 7 minutes, like 5 minutes. Okay, so check the monitor for 3 seconds, done, or less than 3 seconds. Okay, after that, you can expect any rhythm, any change in rhythm, just verbalize quickly. The patient has VF and blah blah. So ask the examiner 2 minutes passed, or the nurse 2 minutes passed. Don't wait for the examiner or for the nurse to ask you. You are the team leader. In practice, you are doing like that. In practice, you are asking the one who his task that the time you are asking here 2 minutes passed. It means you are alert. You are team leader. Okay. If you are not asking, it means you are not understanding what is going on. Okay. So here, if you will say about shock, so connect the defibrillator, charge, for example, the shock, how much? After that shock, clear, everyone clear, shock given, continue CPR, and so on. So don't wait for response. Verbalize them quickly, and so on. Okay, so the next station, what is the station here, guys?
Resuscitation.
Resuscitation.
Okay, what is the case? What is the case?
Neonatal.
Newborn.
Neonatal or newborn?
Newborn.
Newborn.
Okay, so newborn resuscitation. Okay, so here you have to go for this general approach. So number 1, number 2, number 3. Okay, we will discuss everything in details regarding each station, guys. This station, what is the task here?
Communication skills.
Communication skills.
History taking communication.
History taking.
History taking. Okay, so clinical reasoning, it means differential diagnosis and management plan. Clinical reasoning here means differential diagnosis and management plan. Knowledge, history taking, communication skills. I said communication skills, guys, it will be in all stations. It doesn't mean communication station, okay? So what is your task here, number 2?
Take history
History.
and present
History
finding.
presenting, finding, and explain management.
Okay, what is the station?
Throat
Throat
discomfort.
discomfort. This will be
What is the gender?
male.
Male.
What is the age?
Male.
65.
65.
Clear, guys? This
Yes.
how to understand the station. Okay, so 30 seconds. 30 seconds. Okay, so 10 seconds for the pie chart, 10 seconds for the task, 10 seconds for the scenario. So 30 seconds. You still have 30 seconds. Prepare yourself. So I will prepare myself like that. Is it history taking? So we have 3 approaches: Socrates, Odibara, who approach. So throat discomfort, it will be which approach, guys?
Odibara.
Odibara, excellent. So after that, Odibara, and the patient is old age. So it will be clear now. You will follow the general approach of Odibara. Okay, this station, what is the by chart you're talking about? What?
Practical skills.
Practical skills and teaching.
Excellent. And the task is?
Teach junior doctor.
Junior doctor.
Okay. So what is the scenario?
Arterial cannulation.
Arterial cannulation.
Okay. Clear now?
Yes, clear.
10 seconds, 10 seconds, 10 seconds. So we still have 30 seconds. Now I will teach the junior doctor. So I will introduce myself. I will ask what does she know about this issue, and you will give her learning objectives. After that, you will start step by step. So you will talk about the indication, contraindication, complication, and how to avoid complication. After that, you will talk about the technique. After that, after the procedure. So now you are arranging yourself. Once you will go inside, you will do everything well.
Right.
This station, the pie chart,
History taking.
Communication and history taking.
history taking. Okay. The task,
Take history, present your findings, and
History
explain
taking.
your management plan.
okay. And the station is
Regular fever.
Fever.
traveler fever,
Traveler's fever.
travel history. Excellent. This is how to understand the exam. Okay. This station, what is the pie chart?
Resuscitation is
Resuscitation.
Resuscitation. And the task?
Assessing
assessing
management.
Manage the
medical
patient
Resuscitation also.
appropriately.
Resuscitation also. What is the station?
Bilateral valve accreditation.
Pneumonia.
ALS.
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 Excellent. ALS.
Heart
What do you need
failure.
from? Excellent, guy. What do you know from ALS or resuscitation? Ask yourself: is it ALS? Is it ABLS? Is it ATLS? Is it newborn resuscitation? Number 1, right? So this one,
Yes.
ALS, right? Which station? Ask yourself which station. I will give you, for
Pulmonary
example, 10 stations. They will come commonly in the exam. So this station, which one?
Pulmonary edema.
Cardiogenic shock.
Pulmonary edema, it's not coming in the exam.
Heart failure.
No,
Heart
it's
failure.
not coming in the exam.
Sepsis, pneumonia,
Could be
sepsis.
bilateral pneumonia,
Sepsis.
sepsis.
Sepsis. Okay. I want you to be like that in the exam. So ask yourself, yeah, the pie chart is resuscitation. The task is resuscitation. And the station is ALS. Why? Because not trauma, because the age is old. Okay, so it's ALS.
Sorry? Maybe sign of instability.
Yeah, I'm talking now. It's ALS. Why? Because no trauma, and also the age is old. So it's ALS now, not ABLS, not newborn. Okay, not ATLS. So here, bilateral basal crepitation and the hypotension. Think about sepsis. In practice, you have many differential diagnoses, but I'm talking for the purpose of the exam, sepsis. Okay. We will discuss everything in details later. Okay, what is this by chart?
Resuscitation.
That's the
Resuscitation.
task.
Assistant
Assistant manager. Resus.
Resus also. Okay, the
Yeah.
station.
So beautiful.
Is it
ALS.
LS?
ALS
ALS.
and
ALS.
yes, mixed dialysis.
ALS, so maybe ATLS.
Hyperkalemia.
Chronic
Excellent.
kidney disease and then
Kidney
dialysis.
So ALS, number one, ask yourself. So 10 seconds, 10 seconds, 10 seconds. So 10 seconds here, the station is chronic kidney disease. Think about dialysis, think about hyperkalemia, okay? And here, old age. So it's ALS here and hyperkalemia, okay? So this patient, you have to manage hyperkalemia. You have to expect arrhythmia, of course. So they can give you in the start hyperkalemia. Here, if the actor ask you, what is this ECG? Don't waste the time with him. It's hyperkalemia, done. Okay? Even don't tell him, I will teach you later. No need. It's a hyperkalemia, done. Okay? After that, if he give you ABG, so just tell the examiner and your team, so involve always your team. Guys, the patient has hyperkalemia. Guys, the patient has metabolic acidosis. Don't interpret completely, guys. Okay? So here you can, if he asks you, what is this EBG? Don't waste the time with him. He will distract you. And they mean that. They mean that to distract you. They will see if you will waste the time and lose the patient with teaching. It means you are not team leader. Okay? So just inform him, guys, the ABG is metabolic acidosis, and continue with your management. Please give blah, 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 blah. Okay? Guys, the patient has VF or VT. So always involve your team. Okay? Okay. So this by chart is resuscitation. And the task? Resuscitation. The case is?
ALS.
Drug overdose.
ALS.
ALS. Okay. Which ALS? Drug overdose. So the most important in the resuscitation, you ask the team to prepare the things early. So here, what is the most important? Airway equipment?
Antidote.
Or circulation equipment?
Antidotes.
Or antidotes?
Circulation.
Airway.
Of course, airway, but not my point. My point is
Antidote.
yes.
The
I'm talking
preparations.
the most important for the marks. The most important for the mark. Of course, all people, they will mention airway equipment, right?
Yeah.
All people will mention circulation equipment, right?
Yes.
But not all people, they will mention prepare antidotes, right?
Yeah.
Before the patient arrive. Not all people, they will mention contact toxibase. Okay, so here also to save time, you can ask the nurse for airway, please prepare airway equipment, done. No need to say prepare oxygen, prepare nasopharyngeal, prepare oropharyngeal, prepare into tubes, prepare laryngoscope. Okay, guys, this is how to save time. Okay,
That
and
means
this
only we need to say prepare airway equipments, right?
done. Please prepare airway equipment. Please prepare circulation equipment, done. Okay. The most important to call the team early. So here you will call the ALS team early. If pediatric resuscitation early. If trauma team early. Hand over the patient from ambulance group, important. Okay. You will waste time for introduction, maximum 40 seconds. So always verbalize with yourself first, guys, before you practice with your colleagues, practice with your self. So make timer and mention the introduction within 40 seconds, within 30 seconds, and so on. Okay, this is how to pass. So introduction. Okay, so this station, same. Okay. Okay, so if you have bradycardia, verbalize. Guys, the patient has bradyarrhythmia. Okay, so you are involving the team and verbalize to the examiner so he will understand that you are professional. Sometimes you understand it's a complete heart block, but you are silent. You are keeping a secret. The examiner will not give you marks. Okay, so guys, the patient has complete heart block. He has bradyarrhythmia. So please connect the baser. Okay, so which one is better? You will start by 5, 5, 5, 5, or you will start from 30 directly?
So
30.
from
30, save time.
30.
Save time.
yes.
Okay, you will start by 5, no response. I will check the monitor. No response. Okay, increase to 5. I will check the monitor. No, you are wasting time. I want you to be intelligent, fast. Okay, so please start 30 milliampere. What about the monitor? Same. 40. What about the monitor? Same. Increase to 50, and so on. So don't wait the examiner to answer you. Just your eyes check the monitor. Okay, and so on. So after you reach 60, so excellent, guys. We have a electrical capture. Can you check for mechanical capture? Can you check for blood pressure and the pulse? This is how to save time.
The examiner will change the monitor for me.
Yes, the examiner will change for you. So the first one, I don't want to go deep now because our session today not for teaching. I'm just giving you how to get high marks and how to get high score. Okay.
Sir, in ECG, we need to say the exact diagnosis or we need to say that a bradyarrhythmia, tachyarrhythmia?
Bradyarrhythmia. What is the difference if first degree, second degree, third degree? What is the difference? You will give atropine, right?
Yes.
Bradyarrhythmia, symptomatic. So you can say the patient has bradyarrhythmia and he is unstable. So give atropine. So we will discuss everything later. Okay, what about this station?
History taking.
Communication skill. History.
Communication.
Why communication? Why communication? We said communication, it will be in all stations, right?
Yes.
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 So what is the task here?
History taking, sir.
History.
History. So number 1, by chart. Number 2, task. Number 3, what is your
Assess legal high.
Assess legal high.
assess legal high? Okay, so the station is
Assess legal high.
toxicology.
Toxicology.
Toxicology. Okay. So yeah, so you will ask the patient, how can I help you? How can I help you? After that, she will say, I have palpitation. So will you continue or you will relieve palpitation first?
Relieve palpitation.
Relieve palpitation first.
So relieve palpitation, it means management, it means a treatment. You will take consent for treatment or not?
Yes.
Okay, so how can I help you? I have heart racing. I'm sorry to hear that. Can I move you to resuscitation room? You are asking here first. Maybe she will refuse. Can I move you to resuscitation room now? And would you like me to give medicine to relieve you? Yes. Okay. After I give you medicine for your heart racing, are you okay now? Are you comfortable? Yes. Did I mention, guys, the name of the medicine?
No.
No.
Did they test me in knowledge? It's not about knowledge here. Okay. So here is the meaning of knowledge in the pie chart. It doesn't mean the name of the medicine. No, the knowledge here, it means how to run the station. So you will ask about the questions of screening of the substance. Okay, so for example, how many tablets? What is the name of the tablet or the drug? Okay, you are taking with another drug or not? You are taking with alcohol or not? So the screening of the question, it means knowledge. So the knowledge here, it doesn't mean how much is it doesn't mean they will test you in the name of the medicine to relieve the palpitation, okay, or the route, IV or oral. No, okay. Would you like me to give you medicine now to relieve your heart racing? Yes, thank you. Okay. So after that, you will convince here to stop or to decrease this. We will discuss that in details. This one, what is the task? What is the pie chart here?
History taking, sir.
Okay. So what is the task?
Neglect.
History and explain the management plan.
History. The task is history. Okay.
Yes.
And what is the station?
Dental abscess.
Okay. Pediatric or adult?
Pediatric.
Pediatric. Okay.
NAI.
Neglection.
Neglect. So until
And,
proven otherwise, maybe she will say, I seek medical help. Okay. Okay. What is the pie chart here?
History taking again.
History. Okay. What is the task?
Explain the diagnosis to the father. New diagnosis.
New diagnosis. So what is the station?
Decay. No.
Edison crisis.
Edison crisis.
Edison
crisis.
Yes. Low glucose.
Always your eyes on glucose. Okay, guys?
Yes, sir.
Okay. Here, if you don't find blood sugar at all or normal, so maybe asthma, right?
Yes, sir.
So maybe he's talking about asthma. Okay. So you have only 3 new diagnoses: DKA, Addisonian crisis, and asthma. Okay. So what is your pie chart here?
History taking.
History taking. Okay. What is your task?
Holistic examination and
Mental
cognition.
state and cognitions.
Cognition.
Assess mental state and cognition. What does it mean, cognition?
Means it's a psychos.
Many mental state.
Many
And,
mental state.
Yes. And what does it mean, mental?
Mental state.
Any depression.
It means depression, also cognition, also psychosis, and number 4?
Self-harm.
Self-harm. So he's asking you assess mental state. It means cognition, psychosis, self-harm, depression. But he said here, and the cognition, it means cognition here, it will be concise or in details?
In details.
Detail.
And the mental state, it will be concise or in details?
Both are in details.
Concise.
No.
Okay, guys?
Okay.
Yes.
Mental state.
Cognition, the most important. Why? 80 years, confused. So go for deep questions of cognition, okay? Of many mental state. And regarding mental state, concise. For example, depression. How do you feel recently? I'm okay. Or how about your mood? Okay, done. One question enough. Psychosis. Do you hear or smell or see anything unusual? Okay. So here, thought disorder. You can ask, do you feel someone or something interrupting your ideas? Done. No need to ask all questions. Okay. Self-harm. Did you try to harm yourself in the past? No. Done. If you will go home, will you try to harm yourself? No. Okay. So concise questions. Okay. What is your pie chart?
Examination skills.
Examination. Excellent. If you find examination, it means examination. Okay. So what is your task?
Hand examination.
And examination.
Okay. So here, what is the station?
Injury and hand
Pain,
examination.
pain in right hand.
Right hand pain after injury last night. Okay. Gender,
Male.
Male.
age.
35 years.
This is what we need. Okay. Okay. What is pie chart?
Same.
Examination.
Examination.
60%.
Okay. And the teaching. Okay. So what is the difference between examination and history taking? He said here you don't need to
Full
take a full
history.
history. So if you find
Short history we should take.
yes, if you find the history with examination, maximum history like 30 or 20 seconds. Okay, guys?
Yes, sir.
So for example, what is the dominant hand? Right hand. Ask the patient, what is your dominant hand? Okay.
Mhm.
And also if there is injury, okay. So what is the cause of this injury? For example, I was in the farm or I was in the kitchen. So kitchen clean, farm not clean. Okay. Also, are you immunized? Or you can ask by different way. Are your immunizations up to date? And so on. Especially tetanus. You can ask about tetanus.
Yes.
So here, second station, examination, teaching. Here teaching, it will be also maximum 30 or 20 seconds for teaching. Okay, don't waste the time because it's not teaching station. Okay, guys. So here, the patient, the junior doctor, you can introduce yourself to the junior doctor, and you can tell him, I have been informed that you have one patient with hand pain after injury, right? He will say yes. Okay, so I will examine the patient and follow me. Done. Don't waste the time. Okay. And if you will not do that, the examiner will stop you. If you will not do that, the examiner will stop you to save time, to help you. The examiner is instructed to do that with you. Okay. So anyway, you will go for the patient and explain to him, how can I help you? Or you can say to him, anything in the scenario, guys, you can use to save time. I have been informed that you have a right hand pain after injury last night, right? He will say yes. Okay, I am here to help you. I need to examine you. Is that okay with you? Yeah. And this is my colleague. He will be with me. Done. If you want to say for the purpose of teaching, done. Okay. Clear, guys?
Yes, clear. Yes, sir.
Okay. Okay. I'm talking now how to save time, how to get high marks. Okay. The same station, I'm giving you the same station with different pie chart, guys. Okay. So what is the pie chart here?
Examination.
Do you find any history?
Reasoning.
No.
Any teaching?
No.
Okay. So even if you find the history or teaching, don't waste the time. So this one, examination bureau, you will talk with the patient. So go to the patient and inform him or inform her. Okay. I have been informed that you have injury to your face. Is that right? Yeah. So can you tell me more about that? Blah, 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 blah. Are you comfortable now? Do you have any pain? The nurse gave me painkiller, so no need to give her. Or even if she said the nurse gave me painkiller, okay, so you are comfortable now? Yes. You have to confirm comfortability. So ask about comfortability and to confirm about comfortability. Marks for you, okay? But quickly, don't waste the time. So here, how to save time in examination. Okay, so Ask the patient, can you do like that? He will do. Done. Don't tell him extend your arms and splay your fingers and put pillow. No. Just put the pillow. You put the pillow and ask the patient, can you do like that? Done. Second. Okay. Can you do like that? Done. If you see anything, you can verbalize. I can see warm, proximal to the middle finger. Done. Okay. Can you do like that? She will do. Can you do like that? She will do. Can you do like that? She will do. Can you let me to move for you? Done. Okay. Don't let me to push down. So first of all, can you do like that? She will do like that and hold here. Don't let me to push down. Can you do like that? Don't let me to push inside. Can you do like that? Don't let me to push down. Can you hold my fingers by your fingers? Can you hold my fingers by thumb and index? Can you pick up the coin? Okay. So here, hold the finger and tell her, can you bend your finger? Can you do that? Ask her clearly, can you do that? She will say no, because she is actor. It's not patient. If patient, you will test already, because already patient. But this one is actor. Just ask her, she is instructed to answer you. Just pretend. Tell her, I will hold your finger like that. And can you bend your finger? Can you do that? She will say yes. But this one, ask her, can you do that? She will do, but she will say no, I cannot do. Okay. So depend on her verbalization. Don't depend on her movement or of finger, guys. Okay. Because she is not patient. She can move. Clear, guys? Okay. What is the diagnosis here in this image? Guys, what is the diagnosis here?
Median nerve injury.
Profundus, yeah, profundus injury. Because she cannot flex the distal one and she can flex the proximal one. That means the digital profundus injury.
Okay, anyway, we will discuss examination in details, but what I mean from you, here, the patient can move, because if you ask her to bend, she will bend. Here, she will bend. Here, she will bend. Okay? Because she is actor, she is not a professional. Okay? But you can ask her, can you move that? She will say yes. Can you move that? She will say no. Okay, guys? Even she will move. This is my point. Okay? So it's not nerve. Why? Because nerve, you will assess sensory and the motor. Sensory and the motor are okay, so it's not nerve. The problem here, tendon. Okay, we will discuss that in details. Don't worry. Okay, what is the pie chart here?
Resuscitation.
What is the task?
Resuscitation.
The station.
Yes.
ALS.
Hypertension maybe hypovolemia, ATLS.
ATLS. ATLS. Okay. Okay, so this one also resuscitation. Okay, so here regarding this station, already resuscitation, drowsy, overdose, once you will go for ECG, the actor, the junior nurse, he will tell you, doctor, I found this tablet in his pocket. So what will you say, guys?
I need ECG.
ECG.
Okay, so verbalize. Oh, the patient has TCA toxicity, right?
Yeah.
Before ECG. Okay, so the patient has TCA toxicity. So already you can continue if you are in airway. Don't do ECG if you are in airway. Okay, so if you are in C, connect the patient to the monitor and do 12 leads ECG. He will ask you about the ECG. What you will say, guys?
Where is prolongation?
No, don't waste the time. Don't waste the time. The ECG, TCA toxicity, done.
TCA toxicity, okay.
Done. Okay, don't waste the time. And what about the ABG?
Metabolic acidosis.
Done. Don't interpret. Okay, it's not teaching. It's not teaching station. Here, the pie chart. The pie chart is knowledge, clinical reasoning, team leadership, resuscitation. Any mark for teaching here?
No.
No. Okay. So don't waste the time for teaching. But don't ignore him. If he said, what is that? It's a TCA tablets. So it's a TCA toxicity. What is this ECG? TCA toxicity. What is this ABG? Metabolic acidosis. So start fluids, start sodium bicarb. Why? Because metabolic acidosis. Okay. Okay. So, for example, you find this ECG. So it's a VT, shock because the patient unstable. Okay. After that, not responding. What is the next action, guys?
Check for pulse.
Check for pulse and start CPR.
Why CPR?
Defibrillation only.
This one VT. Okay. So check for pulse because maybe pulseless. And if there is pulse, check for blood pressure because maybe stable now. If the patient is stable, so you will go for what?
Synchronized.
Stable.
Stable is
medication.
Medication. Which medication?
Amidorone.
If it is TCA, so sodium bicarbonate.
Okay, TCA toxicity, so
Sodium
amidorone
bicarbonate.
contraindicated.
Sodium bicarbonate.
Already sodium bicarb started from the beginning. Okay, sodium bicarb
Lidocaine.
started, so you will give lidocaine. Okay, okay, take care. Sometimes they will give you 3 shocks and they're not responding, and the patient is still unstable. So you will go for medication, but
infusion.
Don't give amidorone. Okay. Okay, so I will just give you the general checklist for history because the next time, inshallah, we will start history. So quickly, so introduction, I give you this PDF already. So wash hand will be, it's not important, guys. Greet all. So just to say good morning to all. Introduce yourself. I am Dr. Hani, the most senior here. The registrar, the most senior here. May I know your name and age? I have say nothing. Nice to meet you. Confirm present complaint. I wish to say I have been informed that you have chest pain. Is that right? Yes. So you are saving time. I'm sorry to hear that. And here, take consent. I need to take some data from you. Is that okay? Yeah. Are you comfortable now? Do you have any pain? After that, here, chaperone, it's not in all stations. Chaperone here in only stations with pelvic examination or abdomen examination. Okay. So just to say, anyone attend with you? If he said yes, would you like him to attend? Or you can say, would you like a nurse to attend with us? And so on. In some cases, not all cases, check vital signs. For example, if you feel the patient has chest pain or shortness of breath or palpitation, so I need to check the vital sign, or you can talk to the patient better. I need to move you to resuscitation room, check your vital sign to be sure that you are okay. This very good. Open question, can you tell me more about that? And also present the complaint, it depends on the complaint, whatever Socrates, Odebara, or who approach. And as we discussed earlier, here, review of systems, it will be in all stations, like what? Start by the most relevant system. We have 8 systems: GIT, urogenital, dermatology, miscellaneous, cardiovascular, respiratory, CNS, BNS, and musculoskeletal. Here, regarding number 3, number 4, fixes that in all stations. So, all stations, I am talking about Socrates. So, Socrates, after you finish, associated symptoms means relevant systems. Odebara, after you finish, review of system. Who approach, after you finish, review of systems also. Okay. So number 3, number 4, it will be fixed in all history stations. Number 1, number 2, the most relevant. So if the patient has chest pain, guys, which system you will start?
The cardiovascular.
System.
And
Respiratory.
if the patient has headache, you will start by
Neurological.
CNS, BNS, and so if he has, yes, if he has a headache, so you can ask about loss of consciousness, vision problem, also
weakness, numbness.
Yes, musculoskeletal weakness, paralysis, and the numbness. Okay, and so on. If the patient has jaundice, which system for GIT and
urogenital.
Urogenital. Always 2 system by 2 system, guys. GIT always with urogenital. Dermatology always with miscellaneous. Cardiovascular always with
Respiratory.
CNS always with
Musculoskeletal.
Clear?
Yes.
Okay.
So what are the points in there in the miscellaneous system? Miscellaneous means
Constitutional symptoms. Constitutional symptoms. It's fixed
Okay.
in all
Reports like
stations.
body bumps,
Yes.
Loss of weight, like that.
Because all
weight loss,
complications,
appetite.
all symptoms or stations can be because of malignancy, right?
yes.
Headache can be, chest pain can be, shortness of breath, yes. Okay. Hematuria, yes. Okay, guys. So
Yes, sir. Thank you.
dermatology, yes. Chest pain maybe because of herpes or shingles. Okay. Headache, trigeminal neuralgia, right? Okay. So fix number 3, number 4 as that. But number 1, number 2, the most relevant. Number 5, 6, the least relevant. 7, 8, the least relevant. Clear, guys?
Yes, sir.
Because if the examiner, for example, if you said musculoskeletal, he will say, for example, why he asked about musculoskeletal. If you put number 8, no worries, right? But if you put number 1 at it's not relevant, he will wonder, and so on. Past medical, so just verbalize one question. Any past medical disease? Done. Don't ask more than that. Surgical, any previous surgery? Done. Drug and allergy, any prescribed medication? Any allergy? Done. Family history, any disease runs in your family? Done. Social history, you have only 3 questions, guys. Don't increase, please. Whom do you live with and where do you live? Done. Do you smoke, drink alcohol, or by any chance do you use any illicit drugs? Done. Third question, what do you do for a living? Done. Clear, guys? Okay.
Yes, sir.
Sexual history, no need to ask. Travel history, no need to ask. Just ask in details in dysuria or urethral discharge. Travel history, just ask in diarrhea or fever. Okay. Okay. Ice. So would you like to add anything? It's a very good. Don't say I was telling you before, would you like to add anything I missed to ask you? No problem, but I prefer this one. This one is better because if I will say I missed, it means you are not concentrating. So would you like to add anything? After that, what is your concern? Okay. Here, if you forget anything, he will tell you. If you will ask him, would you like to add anything? He will say, yes, I have blah, 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 blah. Okay. So differential diagnosis, tell him the most likely problem according to your data may be blah, blah, blah. But we need to rule out other possibilities. Okay. So start by the most likely problem. Why? Maybe the time will finish. So at least you mention the likely problem. After that, the management. Management here maybe observation, maybe isolation, maybe resuscitation room, maybe consultation for any specialty, maybe refer, maybe discharge, maybe admission. Also, examination in all patients. We need to do examination. We need to do some test. If you will say some test, more than enough. But if you have specific test, mention. For example, chest pain, so heart functions. If the patient has jaundice, so liver function. So be specific. If you find it's a logic. If you don't find it's a logic, we can do some blood test, done. Okay, some imaging, done, and so on. And in the end, did you understand? Is that clear for you? Do you have any further question? Is that okay with you? And so on. Okay, guys. So here again, the things with line, it means it's not important, guys. Okay. Okay, we already finished. Yes, who approach? It will be. I want to emphasize on who approach because it's very important. So here, stations with event. So whatever falls, blah 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 blah. Okay. So who has seen you with this event? Who? When did that event happen? But don't mention event. You can mention, for example, fall. So you can say, who has seen you with this fall? When did that fall happen? And so on. Okay. If you want to say event, no worries also. Before the event, and during the event, and after the event. Here, already you ask about CNS, already you ask about cardiovascular, already you ask about vasovagal, orthostatic hypotension, and the musculoskeletal. Okay, so regarding review of system, don't repeat this question again. Don't repeat CNS, cardiovascular, musculoskeletal. Okay, you still have only GIT, urogenital, dermatology, miscellaneous. We said number 3 and the number 4 are
common for all.
Dermatology and miscellaneous. Fix that in all stages. Okay. Okay. So GIT, urogenital, always together, and we still have respiratory. Okay. So we mentioned already how to concise the approach, and these are the questions for sexual history. Remember that 6 B's, and the travel history. Remember that. You mentioned in details in their station. So sexual, dysuria, urethral discharge, and travel history, diarrhea or fever. Ice, would you like to add anything? What is your concern? What do you expect from us to do? And so on. Okay, explain new diagnosis, the last one. So explain the disease first, after that the crisis. The disease, after that the crisis. The disease, after that the crisis. So introduction, introduce yourself to the relative. How much do you know so far about your son? Blah, 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 blah. Yes, correct. And he was diagnosed by the disease. Explain about the disease. Do you have idea about that? No? Explain about that. And he presented today with critical condition of this disease, which is called blah, blah, blah. What do you think about that? What is your concern? What is your expectation from us? Explain short-term management. He will stay in ICU until full improvement. And I'm sorry to tell you, it's a long-term condition and they need long-term management, blah, 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 blah. After that, brief history. Brief history, guys, only, no need for present here. past medical, surgical, drug, allergy, prenatal, natal, postnatal, family social. Okay, guys, clear that?
Sir, I have a doubt, sir. In this session, during explanation, giving the short-term management and long-term management, should we provide the all drugs name, or should we give it overall idea?
Yes, you have to give details. For example, DKA, you have to talk about insulin and also how to
Fluid
control
and
that.
potassium
Yes,
correction, everything.
but
Okay.
not the dose. Not the dose. It's not
Only medicine name.
Yes, medicine name. Okay, it's not knowledge. Okay,
Thank you.
and welcome. And additionally, you have to talk about bracelet. You have to talk about the card. You have to talk about when to increase the dose and what is the name of the drug. It will be blah blah blah. So you can explain everything. But the most important, don't waste the time for present history, please. No need for present history or associated symptoms. Okay, this concise approach. Okay, so we finished our session today. Okay, guys.
So I have one question.
Yes.
So can you tell me about the markings in the exam? Out of 180, how much we have to get to pass, or to 140? If it is 14
It depends on the performance of your colleagues. Okay.
So any idea about the previous exams? How much was the passing percentile?
Actually, in India, the highest the pass score is higher than UK. For people in our course, they got 156 in India, 156 out of 180. And regarding UK, the highest score maybe 140 plus.
Okay, but how much you need to pass?
Sir, it is a percentile support, or it is a the 50% of the higher marks? It's like
To pass the exam, it depends on the performance of other colleagues. For example, if someone has 10 out of 10, for example, and another one he has 8 out of 10. Okay, how much now?
8.
8 and 10, how much?
9.
18.
18.
18. How many persons?
2.
2 persons. So 18 divided by 2?
9.
So the pass score 9. Clear?
Okay. Okay.
So if all people they have high score, the high score will be high. Okay. And for example, if someone has 0 mark, 0, and someone has 10 out of 10, so how much total?
10.
And
So
how
5
many persons?
5. Okay.
So the pass score will be
5.
Clear?
Yes.
Yes.
Okay. So anyway, don't care about the passing score, guys. If you care about listening to me, not listening to my recordings, listening to me, okay? I will give you the hints and I will give you the feedback to pass, okay? One session with me, one session practice with me, better than one practice with 100 people, okay? So practice with your colleague, it will help you to manage the time, yes, for sure. But you have to put your leg on the right track. Clear, guys?
Yes, sir.
Okay. Any question before we stop?
Yes.
Yes.
Simple question regarding, you said in case of drug overdose,
yeah,
I'm going to ask for prepare antidotes. So is it general antidotes, not special? Just I said.
Excellent. Excellent. You mean about resuscitation preparation?
Yes.
Patient with overdose.
Yes.
Okay. So at that time, already you are working as a team leader in resuscitation room. Already you have narcotics and antidotes in ER, right?
Okay.
Right?
Yes.
Yes.
So you will prepare them. You will prepare them be ready for use. For example, naloxone will be ready. Also, N-acetylcysteine will be ready. Sodium bicarb will be ready. Did you get my point?
Okay. Okay.
Yeah.
That's
So
fine.
you are talking in general. Please prepare all antidotes. Done. Okay.
Okay. That's
If they mention the patient has history of IV drug user, so you can verbalize the patient most likely opiate toxicity. So please prepare what?
Naloxone.
Naloxone. Okay, guys.
Yes, sir.
okay. That's fine. Another question.
Yeah, sure.
For example, when I get a paper in the paper that the gender is a male, so is that this is guaranteed to find inside also the patient is male or?
Yes, of course. If they said male, you will find the male. If you find in the scenario female, it will be.
Okay. Okay, thank you.
Okay. Any other question, guys?
So we will meet on 17th now.
Again?
We will
So
meet the
when-
next on 17th. The next class will be on 17th.
Yeah. Inshallah, we will follow this schedule, inshallah. But just to prepare, the general approach will help you in all stations, but I will help you to concise the stations and I will put in the channel, inshallah.
Thank you.
Sorry, Dr. Hani, I have one question.
Yeah,
Can
sure.
I use direct question to the patient? Like I found in the task, he have like chest pain. Better to ask him how I help you in introduction from start, or I can just tell him, I hear you have chest pain. Can tell me more about this?
Yeah, same.
And which is
You
better?
it's not about better. Better for you to save time, but for the
Yeah,
examiner,
I
both
mean
accept
for
it.
me, yes.
Yeah, for you, it's better to save time. I have been informed that you have chest pain, right? Yeah. It's better than how can I help you? And it will take time. I have chest pain, right? But for the examiner, for the marks, same.
Okay, nice. Thank you.
Welcome.
Excuse me, and for question itself, because this is open question and that one is closed question.
For which one?
If I say to her, for example, I inform you that you have a chest pain, is that right? That closed question. But if I ask, how can I help you? That means open question.
Yes. You can tell him. Can you tell me more about that? Okay. The most important, you have to give the patient a chance to talk in the start of the station.
Okay.
Clear?
Yes, sir.
Yeah. Because already he informs the triage nurse that he has chest pain. Why they mention in the scenario that he has chest pain? Because the nurse asked him, how can I help you also, right?
Okay.
Yeah. Like it happen in practice. Okay. What else, guys?
Thank you, sir.
Okay. Welcome, guys. Inshallah, 17. Bye.
Thank. 17 means tomorrow, sir, right, sir?
Tomorrow is 16.
Today is 16.
17. Today or tomorrow or yesterday, 17.
17. What time? What time, Dr. Ani? What time?
6 to 8
Dr. Ani?
p.m.
Yeah.
6. Okay, 6 to 8 p.m. Okay, thank you.
Okay, welcome.
Thank you.
Bye.
Okay, bye.
Assalamu alaikum, sir. Assalamu alaikum.
Thank you.